Wait. Okay. Hello everybody, good evening. Welcome to my YouTube channel. Hello Wendell, hello Tim, hello ang haba naman ang name na to. A girl with a bongo cat in the head. Hello, Dr. Rice, hello, Elvin, hello, Vim, Lemon, Crescent, hello. Good evening, Doc. It's been a while. Hello, yeah. Hello. Pilsen, hello. 3 a.m. raid, hello. Liu, hello. Garci, hello. Landiin natin. Ay, bawal lumandi. Bawal malandi dito. Unless gusto mo ma-heartbroken. Garlic bread, hello. Usapang puso, pero binigay ko na yung puso ko. Tayo na. Okay, guys. Good evening. Tonight, we're gonna talk about the heart. Actually, I did this medical education stream before, but it was like 2 years ago. If I remember correctly, it was 2 years ago. I was still part of Arsent. I don't know if you guys know that group is a group that's long gone and dead. I used to be part of a I wouldn't call them a country company. I'd call them a group. Hello, Chadomatsu. Yeah. Ito na, nagsisimula na mahuhugot. Wait, Wendell, teka. Wendell, I forgot to... Ooh, Sean Bryant Eterma, thank you for the sub. Wait lang. I'm seeing my mods here, and they don't have the wrench. Asan ka, Wendell? Wendell, I will give you wrench. Paano ba Ayun. Ha! You now have power, Wendell. I have given you power. I don't know if I gave Silas a wrench. Anyway, yeah, this is gonna be a medical education stream about the heart. So this is actually I used this PowerPoint before, but I added a little bit more stuff, and we're gonna mix it up with some YouTube videos. Asa nag-shiori po? Hoy! Tiyo mo, yung mga mods ko naghahanap ng shiori po tsaka shiori bold. Mga hayop. My mods! Control yourselves! Shiori bold. Yeah, PowerPoint presentation. Okay, so we're gonna talk about the heart now. Alright, guys? This is gonna be a short stream. I usually limit my medical education streams to like an hour or an hour 30 minutes because, you know, I know some people have short attention spans when it comes to education and stuff like this. It can get a little boring after a while. I mean, I know I have short attention span. I have a short attention span myself, so... Okay! Alright. Let's go. Let's start, guys. Let's start, boys. Okay. So, we're gonna talk about the heart, and this is the anatomy of the heart, okay? Where is the heart located? It is located in the center of the chest. Alright? A lot of people make this mistake and say that the heart is on the left side of the chest, but that's not true. The heart is at the center, not really the left. But I can see why people would say the heart is on the left, because if you look at this photo, this is the heart. Wait, hold on. Let me use a laser pointer. This is the heart. And you can see that it extends to the left side of the chest. This is called the ventricle, or the apex of the heart is on the left side of the chest. That's why when you feel for the heartbeat, it's stronger on the left side, on the apex. So yeah. Okay. And what else? These are the other parts of the anatomy. So on the chest, you would also find the two lungs. So the left and the right lung. The left has 2 lobes and the right lung has 3 lobes. So you can see 1, 2, 3 lobes in the lung. Left has only 2, 1. And this is the second one. And then the base of the heart. In the heart is covered by a lining here called the pericardium. And it is located behind the sternum of the chest. Okay? You don't see the sternum here on the photo because in this photo they ripped out the rib cage and the sternum. So these are the ribs. But you have a bone here on the center of the chest. If you can feel your chest, that's the bone. That's called the sternum. That's what protects the heart. And then over here, this red one, this large red vessel here is called the aorta. Aorta, and then this one is the vena cava. Okay. May quiz mamaya 1 to 199 ang pass. Oo nga, makinig kayo. You guys get may quiz to, may quiz. Alright, next. Go next. So what is the purpose of the heart? Okay, you guys know. Let's do some recitation. Oh my god, I just realized I left my water downstairs. Okay, recitation tayo, recitation. What is the purpose of the heart? Let me see, what does the chat have to say? Anong purpose ng heart? What is the purpose of the heart? Para magmahal, tangina. Pump blood throughout your body so you don't die, to feel, para masaktan. Diyos ko, ano ba? Ang dami niyong hugot, buisit. Purpose ng heart ay para mahalin ka. Ano ba kayo? Para masaktan. Ang dami niyong hugot. Ano ba? Ay, nako. Anyway, moving on, okay? Moving on, mga heartbroken kayo. Okay. Alright. Purpose of the heart is to pump blood to the other organs of the body, okay? Especially oxygenated blood. That is the purpose of the heart. The heart is a muscle, by the way. It's a very strong muscle in the body. Very strong muscle in the body that pumps blood all throughout your body. So what it does is, hold on, is there a... there we go. Here we go, we have a blood flow. Look at this. We have blood flow here. Now I'm gonna tell you the different parts of the heart, the chambers of the heart. If you remember your biology class in elementary or high school, you know that the human heart has 4 chambers, right? You guys remember that? There are 4 chambers of the heart. You have 2 ventricles and two atria. So this blue, this one, we're going to start with the right. The blue is the right, the red is the left, okay? So, this right here is the vena cava. It's on top, so this is the superior vena cava. And then the bottom here is the inferior vena cava. So inferior because it's at the bottom. Alright? These are blood vessels, big blood vessels, that receive blood from the lungs. Okay? They receive... no, not lungs, sorry. They receive blood from the body, from the rest of the body, not lungs, sorry. So, it is basically the largest vein in the body. And you guys know the difference between arteries and vein, right? Let's see. I'm gonna ask you guys. Quiz, recitation ulit. Oral recitation. What is the difference between an artery and a vein? What is the difference between an artery and vein? Inferior ang bottom. Vein carries deoxygenated, arteries carry oxygenated. Vein have the oxygen. Okay. Okay, good. Some of you remember your biology classes. That's good. Someone here doesn't remember. Arteries in the heart, vein is in the lungs. Artery malaki, vein mali. Oh my god. Okay, for those, the correct answer is vein carries deoxygenated blood, so blood that doesn't have oxygen. And the artery carries, oh wait, sorry. The people would teach that the vein carries deoxygenated blood, right? The vein carries deoxygenated blood and artery carries oxygenated blood, right? That's what some people teach. That's what some people said over here too. But you know what's more accurate? I will tell you what's more accurate. You're gonna find out here. So, going back to this. So this is a vein receiving blood from outside or from other organs, meaning that the blood here is deoxygenated because the other organs already absorb the oxygen from the blood. So after the organs absorb the oxygen from the blood, they go through the vena cavas into the right atrium. This is the right atrium, okay? Okay, this is the right atrium. And the right atrium will pump the blood through the tricuspid valve over here into the right ventricle. Alright? And the right ventricle will pump the blood out through this valve called the pulmonary valve into this is called the pulmonary artery. See, this is here's the trick here. If veins carry the oxygenated blood and arteries carry oxygenated blood, why is this called the pulmonary artery and it carries the oxygenated blood, right? Right? I'll tell you why. The more accurate description of a vein versus artery is that the veins carry blood towards the heart and arteries carry blood outside the heart. That's the difference. That's the actual difference. That's why this is called the pulmonary artery. Okay? It's going out of the heart. So, and arteries supply the blood to an organ. So this pulmonary artery is going to the lungs. Alright? So that's the actual difference between an artery and a vein. It's not exactly arteries carry oxygenated blood. Well, it's true, most arteries carry oxygenated blood, but once you get to the pulmonary artery, that's when it's wrong. So the more accurate one is, it brings the blood outside the heart, and the vein brings blood towards the heart. Yes. Okay. Hello, Charity. So, once the blood goes to the arteries via the pulmonary arteries, so what happens, once the blood goes to the lungs via the pulmonary artery, what happens in the lungs? The lungs will oxygenate the blood. When you're breathing, you are adding oxygen to your blood. And once the blood has been oxygenated, it returns to the heart through the pulmonary veins. See this? Pulmonary veins. There are two pairs. Pulmonary veins over here. It goes back into the heart. And look, it's red now. They're oxygenated, but they go back to the heart via veins. Okay? So, they go back to the heart through the left atrium over here, the left atrium, and then they go past through the mitral valve into the left ventricle. And then the left ventricle is like a very strong part of the heart that pumps the blood outside into the aorta. The aorta is a very high pressure vessel, blood vessel. This is the largest artery in the body. So if this vessel is perforated, you're gonna bleed to death. The pressure of the artery, the pressure of an aorta is so strong that, yeah, you know how in some movies, when you chop someone's body off, it splatters blood like a fountain? Yeah, that's basically what it really happens. Kahit ano lang kahit yung artery sa wrist, the radial artery, if you transect that and you watch the blood just squirt out from that, sometimes it would reach the ceiling. So yeah, the aorta has a lot of branches, and it carries the blood to all different parts of the body, to different organs. So there, you can see it going out, even down here. And then once it's done oxygenating the other parts of the body, the deoxygenated blood will return back through the vena cavas, the superior and inferior vena cavas, into the right atrium, and then to the right ventricle, then to the pulmonary artery, into the lungs to get oxygenated, and then after they get oxygenated, they go back through the pulmonary veins, into the left atrium, and then into the left ventricle, and the cycle continues. Alright? That's that. That is the blood cycle. Okay? It's simple. It's simple. Alright? Did you guys understand that, by the way? I hope you guys did. I hope you guys understood that. I tried to make it as simple as I could. Tanda ko na dahil sa cells at work. Yeah, it's a cycle. It's really just a cycle. Understandable. Okay. Good. Good that you guys understand. Okay. Hold on. Alright. What's my next slide? Hold on. Okay. Alright, next slide. Diseases. We're gonna go to diseases of the heart now. Okay. What diseases of the heart do you guys know? What diseases of the heart do you guys know? I'm actually just gonna cover the most common ones, okay? None of the rare or the uncommon ones, because honestly, in my practice, I haven't seen that many surgical heart diseases, to be honest. A lot of heart diseases are managed medically and not surgically. So what I cover here are more related to surgery, but I can cover a bit of the medical ones. Myocardial infarction, heartbreak, rejection, tangina, thrombosis, stroke. Stroke is actually brain. It's not really a heart problem. Hypertension is a cause of heart disease, actually. Heartbreak. Myocarditis, okay. Heartbreak syndrome. Ano ba? Ang dami niyong may hugot. Ano nangyari? Did you guys get rejected by your girlfriends or busted by your girlfriends or something? Ni-reject ba kayo ng mga crush niyo? Ang dami niyong may hugot dito. Ano to? Ano to? Recently ba kayo na-reject ng crush niyo? Or binrake kayo ng girlfriend niyo? Thrombosis, Thrombosis is not exactly a disease of the heart. Thrombosis can affect any blood vessel. It's more of a blood vessel disease than a heart disease. More peripheral blood vessel. But you can have thrombosis in coronary artery, for example. Ni-reject nyo kami. Ano ba yan? Ay, nako. Congenital heart disease. Oh, that one's good. That one's good. Congenital heart disease. That's actually hard, but I have slides about congenital heart disease. I have not seen so much of that. That's why it's really something it's hard for me to... Actually, heart is one of the hardest things for me to lecture because I don't see much of these. Okay. Alright. Next. Okay, first we'll go to hypertensive heart disease. I remember someone a while ago mentioned hypertension. Hypertension is not a heart disease. It's not really a heart disease. But it is a cause. Tama ba ako? It is a cause, or it is more an effect of heart disease. But it's not exactly a heart disease, hypertension. It will cause the heart disease, but it is not the heart disease. You get what I mean? Okay. Arrhythmia is a condition of the heart. I'll get to that later. Alright? Okay, wait. Alright, here, see? Hypertensive heart disease. What are the causes? Causes of hypertensive heart disease are basically chronically elevated blood pressure. So if you had high blood pressure for a long time, you're definitely prone to have heart disease. Normal blood pressure is 120/80. Pre-hypertension is around 130/90 or 130/80, mga ganun. Hypertension would be 140/90 or 140/100, basically. But hypertension is managed medically, not surgically. So that's why when you're diagnosed with hypertension, you gotta control that, because once you have hypertension, it can cause a lot of diseases in your body. Not just heart disease, it can cause problems in your kidney, it can cause stroke in the brain. Stroke is a brain disease, not a brain in the brain, not exactly heart. Some people mistake stroke to be a heart attack, but it's not. Heart attack is different. Is 140/90 blood pressure bad? Yes, that's hypertension. So, hypertensive heart disease leads to a variety of changes in myocardial structure, coronary vasculature, and conduction system of the heart. Like I said, how does hypertension causes a lot of changes in the body that would lead to bad things? In the case of the heart, changes in myocardial structure means that it will affect the muscles of the heart. Especially if you've been hypertensive for quite a while, it will cause some changes. And coronary vasculature, especially the elasticity of the blood vessels. And conduction of the heart, system of the heart. Pretty much like how the rhythm of the heart and how it beats. Okay? Can anger cause these diseases? Not really, no. What do the two numbers mean in heart rate? What do you mean by... The heart rate is only one number. Heart rate is, the normal is 60 beats to 100 beats per minute. Okay? Anything lower than that is slow heart rate or bradycardia, and anything higher than that is called tachycardia or high heart rate. Mm-hmm. Okay. Alright, some random dude double. Thank you for the sub. Okay. One of the hypertensive heart diseases I am familiar with, sort of familiar with, is left ventricular hypertrophy. When you say hypertrophy, that means it is enlarged, especially the muscle. Left ventricle enlargement. Okay? Left ventricle enlargement. So, okay, here's an example. This is a normal heart. See this? This is the normal heart. If you have a hypertensive heart or a left ventricular hypertrophy, notice the left ventricle. The muscles are a lot thicker here compared to the normal. Okay? Compared to the normal. So, what happens when you have hypertension is that it causes your heart to overwork itself. This is a basic explanation for me to... A basic explanation. You know how when you work out, when you go to the gym or when you exercise and do some workouts, weightliftings and whatever, you would build up muscle, right? When you do it regularly. Zeshu, thank you for the sub. Right? You would get all buffed up from lifting. Like if you lift weights all the time with your arms, you'll get buff muscles on the arms. Right? And if you work some parts of your body, those muscles will get larger. So it's the same thing here. If your heart is overworked because of hypertension, because it causes your heart to work a lot harder than it normally would, the muscle of the heart would get thicker, and you might think that it's a good thing that would make your muscles stronger, the heart stronger, but no. What happens when your ventricle or the muscle of your heart gets thicker, the space inside the chamber gets smaller. Okay? The space gets smaller, and when the space gets smaller, that means your heart is unable to pump blood efficiently. And what happens when your heart is unable to pump blood efficiently? That means, especially on the left ventricle, that means it's unable to, spread the blood. To pump the blood, oxygenated blood back. Around the body. Sometimes the blood will go back to the left atrium. It'll go backwards. And it can cause some damage to the valve that separates the atrium from the ventricle. Yeah, buff heart muscle bad, basically, because it makes the chamber smaller. Is it possible to thin them again? It's very hard to thin them again, actually. Usually medication is given for this. Not really. I haven't heard of a surgery done for this. Medication. You have to control the hypertension because what you don't want is for it to get even thicker than it already is. I think we can look for some photos. Hold on. I will show you a photo of a let me show you guys a photo of a left ventricular hypertrophy, okay? Like an actual one. Hypertrophy. Like an actual photo. Ooh. Okay, get ready for some gross photos, guys. This one? How do I open image. Okay. Alright guys, get ready for some gross photos. Okay? Alright, here we go! Here's an actual photo of... This is a slice of the heart. A slice of the heart, okay, from like top view. Look how thick that muscle is, guys. The arrows pointed out. The arrows pointed out. Look how thick the muscle is. And the space in between is very small. Okay? Yeah, it is deadly. It looks like a fish. Alright? Yeah, this is like one of the severe ones, okay? This is a severe one. Obviously, this patient died because of that. Nakakagutom. Tangina. Okay? So yeah, that's basically a cross section of the heart, like here. Alright? Alright. Next. Wait. Next. Okay. Coronary heart disease. Coronary heart disease. This one I am more familiar with. Because this one requires surgery. Okay. What is a coronary artery? A coronary artery is the blood vessel that supplies the heart. So, you know, the heart pumps blood all over the body, but, you know, even the heart itself needs blood to supply itself. So it also pumps blood to itself, you know. Heart pumps blood to itself as well. Okay? Now, what happens in coronary artery disease? How do you get this? So, this is coronary artery disease. Imagine that this is your artery. It is healthy. It is clean. There is nothing clogging it. Imagine a pipe. Imagine a pipe in your bathroom from the toilet. A pipe. It's a clean pipe. The water flows very smoothly when you flush the toilet. And slowly, your toilet, when you flush a lot of shit in the toilet, like, you know, tissues that don't break in water, like those table napkins, those are not meant for the toilet. If you throw in sanitary napkins, to all those ladies in the chat, if there are any ladies in the chat, do not flush your sanitary napkins into the toilet. You throw them in the trash, please, okay? I have actually seen instances where toilets have been clogged because people flush their sanitary napkins in there. That is disgusting, okay? That is disgusting. And yes, this is fat. This is called fatty deposits. But I'm just making a analogy with pipings in the toilet. Okay? So, imagine having a lot of stuff in the piping. Imagine that, see? Look at that. Look at that. Fatty deposits, making the lumen of your vessel narrower. So here, look at this. This last one is near complete blockage. So imagine you went from this smooth blood flow to this. What happens when the lumen is narrow? Then you would have even to the point that it is completely blocked, you would have less oxygen supplying that part of the body, or is the heart. This is why you would have ischemic heart disease, because if the coronary artery is blocked and it is unable to supply oxygenated blood to the heart, that part of the heart that is supplied by this artery will die. Okay? It's also the same with stroke, actually. In the brain, if you have something there in the brain blocking there are different kinds of stroke, actually. There are two kinds of stroke. There's hemorrhagic stroke and ischemic stroke. So if there's a blockage, ischemic stroke, it causes an infarct, just like in the heart. But yeah, stroke is for the brain, it's not for the heart, okay? Can toilet be clogged with el shito? No. Your shit will be, the feces. Madudurog yan sa tubig, okay? That shit is biodegradable. Come on. Biodegradable. It will not clog. Okay. Alright, next. So what happens, like I said before, if you have a clogged artery in your heart, that part of your heart that is supplied by the artery that is clogged will die because it is unable to receive oxygen. You know what happens when you don't receive oxygen, right? When breathing and you don't get enough oxygen, you die. So, it's like your heart can't breathe. Okay? Did we talk about the brain before? Nope, I have not done brain stream. Okay. If my memory serves me right, the plaque is deposited in the vessel walls, not inside the pipe itself. That's the pipe is. I'm using pipe as an analogy. I'm talking about blood vessel walls, of course, as you see in the photo. Okay. If you have too much plaque in the vessels, it will cause a blockage. Of course, they stick to the walls, but you know, the walls get narrower and narrower because of the plaque. Okay? Next. There, here we go. A dead part of the heart. Ischemic heart disease, as represented by the stock photo. A part of me is dead. You get an emo heart, okay? Part of your heart has died. Okay. There we go. Dead heart. Okay, that eventually if you have eventually if your heart dies, then you'd get a heart attack. Ischemic heart. If a large chunk of your heart has been ischemic, you would get a heart attack. Now, there are different kinds of myocardial infarctions. There's the STEMI and NSTEMI. That's what they call it, the ST elevation myocardial infarction, and then non-ST. But you know, the non-ST elevated myocardial infarction. But that is more medical, so I'm not gonna cover that here. Okay, that is more medically managed. I'm gonna talk about the surgical stuff. This is why I said heart is actually very complicated for me. Okay. Symptoms of coronary or basically hypertensive heart disease. So chest pain is one. Chest pain, especially squeezing chest pain. Sometimes the squeezing chest pain can radiate to your jaw or radiate to your shoulder. Okay. Now, for those people, sometimes I receive messages from people on my Discord or on my private, direct messages, private DMs about complaints of chest pain. I've had a lot. I have had a lot saying, masakit yung puso ko. My heart hurts. They would tell me my heart hurts, and sometimes I would think, how do you know it's your heart that hurts? But anyway, I would assume they mean their chest hurts, because if they say heart, it would mean the chest. So, usually heart disease is more common in older people. People who are obese, people who have diabetes, people who have hypertension. For young people, it is much more uncommon to have a heart disease, unless you have a congenital heart disease, or, genetics just wasn't good to you. Because, if you have parents who have heart disease, you're most likely going to get heart disease. Okay. Hello, Han! Hello, Han! Hello. Alright? Chest pain. But, guys, just because you have chest pain, don't think immediately that you are gonna have a heart attack, okay? There are many causes of chest pain. If your chest pain is the kind that's squeezing, that you can't breathe, the squeezing type of chest pain wherein you can't breathe, then that might probably be something, a heart problem, or maybe even a lung problem. But if it's like a sharp chest pain, that hurts when you move around from stretching, that's most likely not a heart attack or a heart disease, okay? Most likely that's just a strain on your chest. on the muscles. Nicole Cañete, thank you for the sub. Thank you. Puro hugot yung chat. Yeah, I know. The chat is heartbroken. Okay. Because really, I do get some people message me, kind of panicky that their heart hurts or their heart hurts. They would tell me their heart hurts, but you know, turns out that it's most likely just a muscle strain. All right, cold sweats. So this is one. You know, you're all sweaty, and yet the sweat feels cold, and yet you're cold. That's one of the symptoms. Okay. Easy fatigability. You get tired really fast. You know, just walk a few steps and you feel so tired. Or you get shortness of breath. You climb only five steps of stairs and you get tired. Sometimes they would have vomiting. Though, I've had a few patients who had heart disease and they did vomit a few times. But yeah, chest pain is the number one symptom. Okay? Okay, important test done. So if you are suspected to have a heart problem, they would do a bunch of tests. So aside from blood tests, okay. This one. Do you guys know what this is? You guys know what this is? You guys see this a lot in like shows, movies. Especially when you know one of those telenovelas. Yung mga telenovela na may pasyente na admit sa ICU and then they are hooked to a monitor that shows this. Okay. This is called a 12-lead ECG or a 12-lead electrocardiogram. Okay. This is one of the quickest ways to, you know, check the function of the heart. Now, I am going to show you an example of some ECG, okay? I am not very pro at reading ECG. If you are a med student, if you're a med student, they're gonna make you memorize how to read a fucking ECG. And then, you know, when you're a med student, they will teach you how to read the ECG and they're gonna ask you to interpret the ECG. They will teach you that, they will make you memorize that. And then once you're done, once you graduate medicine, you'll forget all about it. You'll forget all about it and you'll just know, this is how a normal ECG looks like. That's all you're gonna remember. You're just gonna remember, this is how a normal ECG looks like. If it doesn't look like this, that means there's something wrong. That's basically how I read an ECG. That's how I read an ECG as a surgeon who doesn't really study, who doesn't handle these things actually. If I receive an ECG, I have to ask an internist to read it for me because I'd be like, this is normal, right? Or if it's like, you know, if it's like this looks abnormal, right? What do you call this? I'd be like that to the internist. Nah, it's common. Seriously. You can ask other surgeons and they won't know how to read an ECG. They will just know what a normal one looks like. If it does not look like the normal one, they will say, okay, that's not normal. Let's refer to the internist. That's what. Of course, we all know what a flat line is. Everyone knows what a flat line is. Even a non-doctor would know what a flat line is. Okay. Anyway, let me show you guys, hold on. I'm gonna show you guys an example of some ECG stuff. Okay. Where's a sample of an ECG here? Wait, hold on. Okay, here. Let's what's gonna be it? Alright, ECG, guys. Alright. Okay. ECG is... Here we go. I think this is a good one. Oh god, it's so small. Open image in new tab. Ang liit naman. Wait, why is it so tiny? Tayo na liit. Is there a better one? Okay, here we go. Let's just click this. It's so tiny. Open image in new. Ah, there we go. There we go. There we go. Okay. This is a how to read. I'll show you basic ECG, okay? How to read a basic ECG. This is how we name it, okay? This is a little complicated, so I would understand if you guys get confused, okay? But I will tell you how the different parts of an ECG. So this one, there are different types of waves. Each wave has a name, has a label, and it's labeled by letters P, Q, R, S, T, U. Okay? We actually have to name each wave. This is the P wave, this is the Q wave, and then the P wave is the first one, and then the first wave that goes downward is called the Q wave, and then the sharp wave that goes all the way on top is called the R wave, and then it goes down to the S wave, and then the next is a T wave and a U wave. Yeah, we gotta memorize this. Basically, that's just the different parts of the wave, and you have in med school you actually have to memorize this. But if I were to put it as simple as possible, the P wave is an atrial contraction. So if the atrium of the heart contracts, you would produce a P wave, and if the ventricles contract, you would produce the QRS interval, or the QRS waves here. Basically, that's it. This is your lub-dub. Your lub is the P and your dub is the QRS. That is the most layman and easiest, simplest way I can put it. I don't know. Basically. Okay. Bakit hindi na lang A, B, C, D, E, F? You know, that's actually a good idea. I actually don't know. They just decided to go with P, Q, R, S, T, U. Okay. Now, let me look at some... Alright. What is a normal ECG? Okay, here we go. This is normal. This is a normal ECG wave, okay? That's why I told you, surgeons who do not specialize in heart, you know, they would tell you to memorize what a normal ECG is and what an abnormal ECG is in med school. But once you leave med school, you're gonna forget all of that. You're just gonna remember what a normal ECG looks like. So, by eyeballing, this looks normal to me. It looks normal to me. I may be wrong, but it looks normal to me. Actually, it looks normal. It looks normal. If an ECG does not look like this, that means it's abnormal. That's how we do it. Okay. Alright, hold on. Okay, let's go back to my... Okay, let's go back here. Alright, next. Aside from ECG, there's a thing called ultrasound or 2D echo. Two-dimensional echo of the heart. So, the image I got here is actually an ultrasound of the abdomen, but I tried to look for 2D echo cartoony image, but yeah, there wasn't any. They just gave me this. So, yeah, it's not the image itself is not accurate. The probe is supposed to be here, but it's not happening. so anyway, 2D echo checks the heart and the chambers of the heart and the valves. That's how they see it through the ultrasound. And then they also check they can also see if there is backflow of blood through the valves. So actually, 2D echoes can tell you if there's a problem with your valve, if there's regurgitations of blood, and stuff like that. And also if there is yung sinasabing butas sa puso. Okay? Yep. Alright. Next. Okay. Next, we have coronary angiography. This is this is an invasive diagnostic procedure. This is an invasive diagnostic procedure because what you do is you're going to inject a dye into the coronary arteries just to see if there are any blockages. So what happens is through your femoral artery here, sa singit mo, on your leg, on your thigh, on your inner thigh. This is the femoral artery. They put a catheter through your leg, and they guide the catheter up to your aorta, as you can see here, aorta, and then they're going to look for your left coronary artery. And once it enters the left coronary artery, they're going to inject a dye or a contrast agent. And then once they do that, they're going to flash some x-rays. X-ray. Okay. And this is what you would see if there is a blockage. You would see this. Look at this. This right here. You can see the rest of the arteries are smooth and no filling defects. But over here, there's a sudden filling defect or like an indentation. Okay? So that means there's a blockage going on here. I'll show you an actual photo. How long does that take? This one doesn't take that long. It takes as long as a CT scan. Alright, this is a sample photo of a coronary angiography. So this, you can see that the vessels take the shape of the heart. These are the coronary arteries. And they show you can see that it's wrapping the heart. It's supplying the heart. Now, you can see that the black is the dye. So you can see the vessels. Now, if you look at the vessels really closely, there is an artery. There is actually an artery here that has a blockage. There's an actual artery here. Based on this image, there is an artery with a blockage, and it's right here. Look at this. You see this? You can see that it suddenly thins out over here. So there is a plaque here, or something limiting blockage, like I said. Coronary artery disease. This is it. This is your coronary artery disease. That's why, if you have coronary artery disease, they need to have this done. Coronary angiogram to identify which vessel is the problem. And this one accurately depicts that there is a problem over here. Okay? The rest look okay so far. I don't see any other ones. This is the most obvious one over here. Okay? So, once you have all the blood tests, all the imagings needed, that's when you can go for the treatment. There are two types of treatment for coronary artery disease. One of them is minimally invasive, which is called the percutaneous coronary artery intervention. So this one is not exactly a surgery. It's very minimally invasive. What they do is they put a catheter. From what I know, it's through your arm. They put a small catheter, just like with the coronary angiography, and then they enter the coronary. They look for the coronary artery that has the plaque, like this here, as you can see. as you can see over here. And then they inflate, once they insert the catheter through, and then they inflate the balloon to make a space, so that the blood flow can flow very freely again. Alright? I will look for a video representation. I think it would be a lot better if we had a video. Hold on. I have one, wait. Oh, here we go. Angioplasty procedure, guys. Okay.
Coronary angioplasty, also called as the percutaneous transluminal or balloon angioplasty, is a treatment procedure to restore the blood flow in the narrowed or blocked coronary arteries caused due to plaques or blood clots.
This is a good video about it.
Most angioplasty procedures last between 30 minutes to 3 hours. Once the patient is admitted, his heart is monitored and is given an intravenous sedative to relax the body. A needle is inserted through the wrist into the radial artery. A guard wire is then passed through the needle and is guided through the arterial system up to the heart. A flexible catheter is slipped over
that's
the
what I'm
wire
talking about,
and
the catheter
up to the heart. This is monitored using a continuous X-ray imaging device called fluoroscope. At this point, the guard wire is removed and the tip of catheter is positioned to enter the coronary artery. A special dye is injected which allows the fluoroscope to take X-ray images of the arterial interiors and help in identifying the position of the block. This is called angiogram. Once the blockage is identified, a flexible guard wire is inserted into the artery vessel, followed by a balloon-tipped catheter over this wire to position itself at the site
and then they're
of
gonna inflate the there you go.
Rapid inflation and deflation of the small balloon pushes the vessel wall out, re-establishing the flow of blood in the artery. After the blocked vessel is reopened, the deflated balloon catheter is withdrawn from the artery. The same treatment procedure is repeated in the case of multiple blockages. Most patients may also receive a coronary stent.
There you go. There's another one called the stent.
Small tube made of wire mesh designed to keep the artery open once it has been treated.
I think I have a slide of this.
Is placed over the deflated balloon catheter as it is inserted into position. When the balloon is inflated, the stent expands and locks itself into place. The deflated balloon and catheter are withdrawn, leaving the stent behind to hold the artery open permanently.
They won't be able to overinflate it.
Post-treatment, a pressure bandage is applied over the radial artery to prevent bleeding. One will need to lie down for several hours, during which signs of bleeding or chest pain will be monitored. The patient may either be discharged on the same day or after an overnight stay at the hospital.
Alright. There you go. So... okay. So that's coronary angiograms. That one is usually done by cardiologists, not surgeons, because it's not a surgical procedure. Here you go. Here's the stent. There's balloon angioplasty, and then the stent. Okay, that which was shown on the video. Alright? Yeah, and they will. It can be repeated for other areas that have plaque, but see, the problem with the percutaneous coronary intervention, or you know, the balloon angioplasty and the stent, is that you know, you can still form plaque again on the same area. Okay, it can still form in the same area again, causing the same thing. And you know what happens when that happens? Then that's when surgery comes in. This is the surgery for coronary artery disease. Okay, it is called the coronary artery bypass grafting. In short, we call this Instead of, there's a short term, we call this cabbage. Okay? We call it cabbage for short. Instead of just saying coronary artery bypass grafting. The shortcut term is cabbage. So if you hear a surgeon say, oh, he's for cabbage. He's for cabbage. For cabbage. It's this. Cabbage, okay? Is it dangerous? You can't just remove the plaque, okay? For one, you might damage the vessel because plaque sticks to the vessel wall. Alright? So, how is cabbage done? Cabbage or coronary artery bypass grafting, you're basically going to make a detour. So let's say here in this image, this yellow dots here, you see these are areas where there is blockage or where there's plaque. So that means the blood cannot flow to this part of the heart and blood cannot flow to this part of the heart. So what happens? What do you do in a cabbage surgery? In a cabbage surgery, it is a very major operation. It can take hours depending on how many arteries are blocked. Okay, this is a cabbage requires a team of surgeons, specialized surgeons. Because one team, a team that will be divided into two, by the way, because one part of the team will be on the leg. They will be operating on the leg, and they will remove a blood vessel on the leg called the saphenous vein. Sometimes they can also remove the radial artery here on the arm. But usually it's the saphenous vein on the leg. They will remove a portion of the saphenous vein on the leg, and they will use that to connect the aorta or the proximal part of the aorta to a distal part of the blood vessel of the coronary artery. As you can see here, look. This saphenous vein is connected from here and here to here, bypassing the blockage. So that's why it's called a bypass surgery. You're just bypassing the blockage. The same here. Radial artery bypass. This is what they used the radial artery. They connected from here to here, below the blockage. Okay? That is a cabbage. And it can take a long time depending on how many vessels are blocked. Sometimes it's just one vessel. It can take, 2 hours? The more vessels there are, the more hours it'll take. I have assisted, since this is not exactly a specialty of a general surgeon. This is a specialized surgery already. This is for TCVS doctors or heart surgeons, thoracocardiovascular surgeons, or basically open heart surgeries. So I have seen 3 vessel cabbage. That shit was long. That took 4 or 5 hours. There are some that were 4 vessels. That takes even longer. No, the blockage isn't removed. It can't be removed. You cannot, because it's stuck to the wall. Look at this. If you look at this image over here, the plaque sticks to the wall. So trying to remove it or scrape it off, or you're just gonna damage the vessel. And if you damage the vessel, it'll just pop. Okay? Okay, wait. Before that, I will look for a video to demonstrate to you cabbage. Okay? Hold on. Let's look for a cabbage. I think I have one here. Aha! This one is very simple. Very simple video. Let's go, cabbage.
Heart bypass surgery creates a new route called a bypass for blood and oxygen to reach the heart. Heart bypass surgery begins with an incision in the chest, and the breastbone is cut, exposing the heart.
Yeah, that's the sternum.
Next,
the breastbone.
a portion of the saphenous vein, which is very large, is harvested from the inside of the leg. Pieces of this large vein are used to bypass the blocked coronary arteries, which are arteries that supply blood to the heart. The venous graft is sewn to the aorta, the main artery of the body, and to the affected coronary artery to bypass the blocked site. The internal mammary artery from the chest may also be used
Oh,
to
there.
bypass
They
the
also
clogged
use that
artery.
aside from the radial
Several
artery.
arteries
Internal
may be
mammary
bypassed
artery.
depending on the condition of the heart. After the graft is created, the breastbone and chest are closed.
Okay. There you go. Okay. That is bypass. How is the chest? Okay. For those curious, when you have a cabbage surgery, you know, you have to open up the skin in the chest and then you reach the bone, right? How do they open up the bone? They use a sternal saw. They use a saw. They cut open the bone so they can access your chest. It's called a sternal saw. Now, how will they close that? You might ask. They close it using wires. The video made it look simple. Yeah, it is simple, it's just tedious to do. They close the chest using wires, especially the bones. They use wire sutures, like literal metal wires to close the bone. That's why for those patients who had heart surgery, open heart surgery, if you take their x-ray and look at their x-ray, you're gonna see the wires on their chest. You're gonna see the wires on their chest. Let's see, post-cabbage chest x-ray. I'll show you guys. Is there a post-cabbage chest x-ray here? Here we go. This one is aha, this is a good example. Here. I'm gonna show you guys how a chest x-ray of someone who had a cabbage procedure done looks like. Okay. Here we go. Look at this. Look at this. You see look at the center of his chest. You can see the wires connecting the bones together, the bone together. Okay. It's like metal wire. So, if you see a chest x-ray that has this, that's metal, that means he underwent an open heart surgery. Okay? Are there a lot of saphenous veins? There's only 2, one for each leg. Okay? Alright. Ooh, it's 9:46. Okay, I'm taking a lot longer than usual. I'm taking a lot longer than planned. Okay, let's continue. We'll go through the next few slides a little more quickly. The next slides are congenital heart disease. I'll just go through these really briefly because these are heart diseases I have not really exactly encountered in my surgical practice. Probably I did encounter it, but then they didn't need surgery because some of the congenital heart diseases, they don't need surgery. They would close up or heal after a few years. Okay? Baby. Alright, congenital heart diseases are heart diseases of newborn babies. They are born with it. Sometimes they recover after a few years. Like if they have yung buta sa puso, it would heal up. And oh, hello bread. Anong lack of boobs? Alright. We have the acyanotic congenital heart disease. When you say acyanotic, these are the ones that do not turn blue. Because when you say cyanotic, that means you turn blue. So these are the ones where you don't get any discolorations in your skin. Okay? So this is the atrial septal defect, or ASD. This is where you have a hole connecting both atriums together, the right atrium and the left atrium, and you have a hole here. Now, this one, if you're born with this, usually this would close. If it's small enough, it'll close on its own, and you won't need surgery. Okay? If you're a newborn, after a few years, it'll close. But if it doesn't close and the hole is very small, sometimes you don't really need surgery. You can live with it. You can live with it. you won't really need surgery. You would usually need surgery for this if it's too big, okay? The next one is ventricular septal defect, or VSD, which is a hole in the ventricles here. Unlike in the other one is atrium, this one is in the ventricles. In the same way, just like an atrial septal defect, if you are born with this, if it's small enough, it can heal on its own as you grow, as a baby. It'll close. If it doesn't close and if it's too large, then you would need surgery. Sometimes people can survive with this as long as it's small. They won't need surgery, they just need to take medications and they'll be good. Alright? Next is patent ductus arteriosus, or PDA. So what is patent ductus arteriosus? It's when the aorta is connected to your pulmonary artery here. There's a small connection or defect here. These close as you grow older, or no, not really. Like when you're 2 years old, from newborn baby to 2 years old, usually they would close. But if it stays open and if it's too big, then you would need a surgery for it. All right. What they would do is usually they would just ligate this. That's it. All right. Will that have problem with delivering oxygenated blood throughout the body? Not, as long as it's small, as long as the defect is small, then there's no problem. The problem wouldn't be too bad, basically. But if it's too big, then that's when it becomes a problem. That's why you would need a surgery for it. Okay? Most people can survive with this as long as it's small. Next is coarctation of the aorta. So if you notice the aorta here, look at this, it narrows up here. This causes some hypertension in some children. Okay? This can cause hypertension in some children. And this one needs surgery. You'll definitely need surgery for this. Probably a shunt. Now, I have not seen a surgery for this one. That's why I cannot give as much information about the coarctation of the aorta. Actually, to be honest, I have not seen this in my practice. Okay. Okay. Aortic stenosis. Aortic stenosis, this is under the valve diseases. So if you look at here, if you have aortic stenosis, it is a disease of the valve in the aorta. Over here, this one right here. The valve of the aorta, or the aortic valve, is thickened. And what happens when it's thickened? You would have regurgitation. Look at this. Blood squirting. Squirting instead of freely flowing. Alright? You can also notice that it can cause left ventricular hypertrophy, or it is closely related to left ventricular hypertrophy. Alright? This one's valvular problems would require surgery. What they would do is replace the valves with mechanical ones, or artificial ones. There we go. Not mechanical. Artificial ones. I have seen a valve surgery, but the one I saw is this one. I think the one I saw is a mitral valve surgery. This one is pulmonary valve stenosis. So it's the same thing, basically. Same thing, but the valve affected is the pulmonary valve. Alright? Cyanotic. So this one is a congenital heart disease wherein at a certain position, if a child, for example, squats, you would notice that his skin color would turn blue, his mouth would turn blue, his fingers would turn blue. This is, he becomes cyanotic. That's what you call cyanotic. Usually seen in tetralogy of Fallot. So why is it called tetralogy of Fallot? You have 4 problems in your heart. So 1, you have an overriding aorta. Look at this. Basically, Your left ventricle is not connected to your aorta. You have a pulmonic stenosis. You have a ventricular septal defect. You have right ventricular hypertrophy. You basically have 4 problems in your heart. Okay. Alright. Now, this kind of congenital disease needs, needs surgery. Literally blue. Yeah, cyanotic. Wait, I made a mistake. Overriding aorta. I forgot. No, this is the aorta is actually connected to the. Is connected directly above a ventricular septal defect. So here, it's not that it's not connected. It is, but it's not supposed to be connected there. I have not seen an actual heart with tetralogy of Fallot, but I have seen a child with tetralogy of Fallot. He would turn blue when he sits down. Literally blue. I'll show you. Let me show you. Cyanotic. Cyanosis. Tetralogy of Fallot. I will show you. Let's look for an actual child. Oh, like, okay. Let's look at an actual child here. This one right here. Okay. You see the child on the upper right? Oops. The child on the upper right. His mouth is dark blue. That's cyanosis. Usually it's on the fingertips and the mouth when you would notice. Here we go. Children with tetralogy of Fallot exhibit bluish skin during episodes of crying or feeding. Here. They would look like that. I don't know if there's like an actual photo of a child like that. I have not seen any. No, this kid right here has. There's a kid here with blue blue tongue, blue mouth. Okay, that's cyanosis. All right. So yeah, look, it's a blue baby. Blue baby. Transposition of the great arteries. This one is another cyanotic condition. This also needs surgery. Children with this kind of heart disease, if they're not operated on, they wouldn't even live beyond 1 year old. So what does it mean, transposition of the great arteries? It means, look, normally the aorta is connected to the left ventricle, and the pulmonary artery is connected to the right ventricle, but in this disease, the aorta is connected to the right ventricle and the pulmonary artery is connected to the left ventricle. And there's also a patent ductus arteriosus over here. There's a vessel, an odd vessel connecting the aorta and the pulmonary artery. So yeah. If it is in the Philippines, ang na-encanto na yan na sa feature na sa Jessica. So, alright. So, I think that's the last slide. Is it? Yeah, it is the last slide. So, yes! Oxygen is your waifu. Basically. If you guys, yung mga heartbroken dyan, at na-reject ng crush nila, make oxygen your waifu so you can live. You can't live without oxygen, so therefore oxygen has to be your waifu. Yes, right? Right? Okay. That's my take-home message sa mga may hugot na humuhugot dyan sa chat. Oto-chan. No waifu, no laifu. Yeah. But oxygen, pwede naman ikaw, Doc, ang waifu. No. I cannot be your waifu, guys. I cannot be your waifu, but you can be my waifu. You guys will be my waifu. The chat is my waifu. Okay. I hope you guys learned a lot. Okay, guys, did you guys learn a lot? Can you be my oxygen? I hope you guys learned something. I hope you guys liked the lecture. Glad to know I'm a wife in some context. Nice. Yes, I am waifu even with my wispy facial hair. Quiz na ba? Ay, wow. So, okay. Ayan, yung classmate niyong si iMac, your classmate iMac has reminded me about the quiz, so I will give you guys a quiz. Ayan. Naalala niya may quiz. Okay, guys. Prepare one fourth sheet of paper. Ay, makpabibo sa parang. Ala, galit na kay Ayo. Hala, yung keyboard ko. Yari. Teka, my keyboard got disconnected. Wait. Let's turn on the wireless mode. Sumakit ulo ko, Dok. Wala na, galit na yung mga kaklase mo sa'yo. Teka, hold on, guys. Wait. Let me get my tablet. I forgot to prepare my tablet for this. Alright. Wait. Okay, did you guys prepare 1/4 sheet of paper para sa quiz nyo? 1/4 sheet of paper. One half crosswise. Ay nako, bahala kayo dyan. 1/4 sheet of paper, guys. Where's my wrist? Wait. Ay nako. I can't find my thingy. Hold on. Okay, ball pen. I'll use blue ink. Blue. Wala! Anong time na? Time na kayo dyan. Okay. Okay. Question number 1. Question number 1. Question number 1. Teka. Ito, 1. Kaya hindi ako makasulat na maayos. I don't have my glove thing. Wait. Ano ba to? Teka. Ito na lang. Question number 1. Question number 1. What is the difference between artery and vein? Artery versus vein. O, yan ha. Alam niyo na yung sagot niya na. Sinagot ko yan kanina ha. Manila paper. Dali! What is the difference between artery and vein? Oy, kung hindi niyo sinagot to, bagsak kayong lahat. Manila paper. Let's see. Vein carries blood to heart, artery pumps blood from heart to other organs, artery oxygen. Pag mag-top may prize, Doc, may prize from me. Maybe, pag-isipan ko. Depende. Kailangan perfect yung score. Vein carries blood. Artery sends blood outside the heart, vein sends blood to heart. Meanwhile, nasa kantin ako cutting classes na. Si Hato nag-cutting classes pala. Hi, Ventix. Okay. Okay, the answer to number 1 is... Artery brings blood away from the heart and vein brings blood towards the heart. Okay. Doc, walang price, no motivation. Hype kayo! Okay. Question number 2. Question number 2. Okay, question number 2, guys. Okay, sino ang mahal nyo? There can only be one answer. Tangin ang quiz naman to. Sino mahal nyo? Answer, magmahal di mali ang magmahal. Mahal ko si siya. Wow! Ang daming a lot of people got number 2 correctly. Hindi ko mahal si Ayo. Nako, patay ka, Aymak. Ang daming galit sa'yo. Ikaw kasi, pinaalala mo sa akin, may quiz pala. Sino ma... Wow ha, to mahal ko po sarili. Kasi you cannot love others unless you love yourself. Napaka-deep naman. Okay, number 3. Last number. Mahal lang langis. Hala, si Silos mod. Sarili kong mod, hindi ako mahal. Sarili kong mod, hindi ako mahal. Paano kung kinik ko tong mod na to? Tanggalin ko yung wrench. Kick natin si Silos, no? Kick ko kaya si Silos. Wendell, kick mo nga si Silos. Oh, number 3. Number 3 quiz. Give me your best pickup lines, guys. Best pickup line. Sige nga, pick up nyo ako. Anong Hindi kita binuli, Silos, ha? Tinulungan kita sa Facebook. Remove wrench from Silos. Wala ka ng wrench, Silos. Hindi ako heart donor pero ibibigay ko puso ko sa'yo. You dropped something, your standards, please go out. nga, best pick-up lines nyo. Binuhat si Doc. Nakakasaway na ang yakapin yung unan. Pwede bang ikaw na lang? Sino may extra ballpen, ma'am? Suka akong ballpen. Wait lang. Cardiologist ka ba? Kasi tanging ikaw lang ang makakagamot sa nahihirapan ko po. Silos, are you my toe? Cause I keep banging you all over different furniture. Ang score ko sa quiz ay parang nararamdam ko sa'yo. Bagsak na bagsak. Silos! Tayo na yun. Gagi! Sige nga, si Silos na top score. Ibabalik ko na yung wrench mo, Silos. Ibabalik ko na yung wrench mo, Silos. Tangina. I think yan yung result ng ng ilang reacts na ba yung post mo, Silos? Parang last ko nakita nasa 150 yung reacts. Okay. 170. Wow, malapit ka na Malapit ka na ilang buwan na yan? 3, 6, 9, 12, 18. Pucha, 6 months na yata. 6 months! Malapit na 6 months yung... Okay. Alright, guys. That ends my stream. Okay. That ends my stream for tonight. Thank you everyone for coming to my stream. Thank you everyone for coming to my medical education stream. Mahal ko kayo. You guys are my waifu. My chat is my waifu. Alright, otsupon everyone! Otsupon! Unfortunately, I don't think I have the YouTube raid feature activated or whatever. So, I won't be raiding anyone. Bahala na kayo kung sino i-raid nyo. Like manual raiding. I will be streaming again tomorrow. I will make a stream schedule for the week later. Popost ko na lang. Otsupuso. Otsupuso. Okay. I will make a schedule later. I might be able to play Elden Ring. I'm going to try Elden Ring this week. Okay, we will try. I will see if I can play Elden Ring. I'll probably put like 1 or 2 days Elden Ring. Kanya-kanyang raid, oo. Alright. We'll see. And I'll probably have one VR stream. Online siguro, Doc, raid natin. Kayo, raid nyo na nga. Raid nyo sigura. Alright, Otsupuso. Okay, Otsupuso. I'll see you guys tomorrow, okay? Most likely 2 p.m. in the afternoon, because that's my best time. We'll see if not 2 p.m. 8:30, okay? Bye bye everyone. Good night. Good night. Bye bye.